If you have an insurance policy that lets you pick your dentist, generally we take that insurance. If you have an insurance policy that limits you to a list of providers, I may or may not take your insurance. It depends. Some insurance plans will let you go out of network, some will not. So if you have a question about insurance, you can always call our office and give us the information on your insurance card, and we can let you know whether we take your insurance and what your benefits will be at our office. A lot of people come into my office and ask, do we take Medicaid? And the answer is unfortunately no, and that's the answer that you get from most dentists. The reason is very simple. The reimbursement rate on Medicaid is very, very low, and most dentists actually lose money when you try to treat patients with Medicaid. And unfortunately, in the world we live in today, you can't run a business like that. So it's a situation where I like to help people. I do have situations where I do pro bono free work for patients who are desperately in need of dentistry, but generally speaking, I do not take Medicaid or Head Start or anything like that because the reimbursement rate does not allow me to pay myself. Of course, one of the biggest questions patients always have when it comes to treatment is what's it going to cost and how am I going to pay for it? Generally, we do not offer financing in our office because it's costly. It costs more to carry balances with a lot of patients, and therefore then I have to raise my fees for everyone to make up for that cost, and I don't like to do that. I also don't like to offer programs like Care Credit, which a lot of medical and dental offices and even veterinary offices I've seen offer, because the interest rate on those programs are very high. They start generally around 13% from what I've seen, and they jump up over 25, 30% very quickly if you miss a payment. And I don't think that's fair to the patient. And I don't want to put my patient in a situation where if they miss a payment, all of a sudden they're stuck with a 30% interest rate on a high balance, and it's because they can't pay my bill. So I generally, when it's in a situation where a patient needs a lot of treatment and it's beyond what they can pay all at once, we definitely have to start working with finding a dental budget for that patient. Let's say a treatment plan is $10,000 and a patient can't afford that. Well, we have to find a way to budget out treatment over time to be able to get the treatment they need without compromising the quality of care and still getting them to their end goals. It might take a couple of years to get this treatment done, but we'll be making progress on the way, and when we get there, you'll have the best treatment that money can buy. My name is Dr. Eric Meeker. I look forward to treating you and your family.